Knock, knock, knock. Hello, my name is Tiana. I'm going to be your nursing student. Can you tell me your name and date of birth, please?
Ella Cruiser 10403.
Awesome. Checking your wristband. Do you have any allergies today?
No.
Also checking your wristband. I'm performing hand hygiene. I'm pulling the curtain to provide for privacy. I will need PPE later in this video for, I'm going to use gloves. Looking at your provider's orders here, I'm going to do a sterile wound change, or sterile, dressing wound change. So I'm going to take off your bandage, assess it, look at it, clean it up, and then we'll get a new one on. I'll ask you a few questions. Do you have any concerns before we begin?
No.
No? Awesome. Are you in a comfortable position?
Yes.
Good. Okay, I've gathered and cleansed all my equipment. For the sake of this video, we've used our equipment already, so it can't be intact. We just don't have the resources for that, but I would go through and look that they're all intact, haven't been opened, and all of the expiration dates have not passed, so that they're good to be used. Same with my sterile, or my saline, my sterile fluid, which is not been opened and it's intact and it is not expired, as well as my wrapped sterile instruments. I'm going to perform hand hygiene, the 5 moments of hand hygiene, or before and after a procedure, before and after coming in contact or doing patient care, if my hands are visibly soiled, after contact with bodily fluids and a patient's belongings. Alright, so now I'm going to be assessing the wound. I'm going to remove the bandage and assess it. So I'm going to be looking for size, shape, where it's located, and everything. I'm putting the bed up to working height, and I'm going to apply gloves. I'm looking for the type of drainage. So serous would be plasma, white to, it's like thin, clear, clear to light straw colored, or sanguinous, which is fresh bleeding, so it'd be bright red. Serosanguinous would be a mixture of serous and sanguinous, so it'd be bright, or it'd be a diluted red or pink with like water in it. And then purulent, which is a sign of infection, which would be a sign of infection. It'd be opaque, thick and light creamy, and then it'd be like yellow, brown, or green, and it would have odor. Are you in any pain right now, sir? If so, rate it on a scale of 0 to 10.
5.
Awesome. And then I'm going to assess that with using the old cart method, which would be onset, location, duration, characteristics, what aggravates it, what relieves it, the timing, like when it happens, and then the severity, which was the scale, and then I would pre-medicate my client 30 minutes till when I would start this procedure. So I have this. I'm going to lift this up just out of habit. So I'm going to expose the dressing so I can work on it. I'm going to remove, I'm looking for this type of drainage and the amount and what kind of wound it is. So carefully, not seeing any drainage. If anything, it'd be a little bit of serous drainage, and it's a surgical wound. It's on the right anterior chest, along the pectoral, and it's lateral to the midline. So I would crumple this all up and put it in my glove to take it, and then take my gloves off without touching my skin to dispose of it properly. But for the sake of other people having to use it, I'm just going to place it over here. Now that I've assessed that, I'm going to remove my gloves properly without touching any of the outside, and then re-sanitize. I've assessed the wound, and now I'm going to set my sterile field on a sterile surface, or not a sterile surface, a clean, dry surface, and it's above my waist, and so is the bed. And then my patient's within reach. So I'm just going to move this over a little bit. I'm going to start with the package, or the drape, so pull that over. And then the 9, before I continue, I'm going to leave that open. The 9 sterile principles are 1-inch borders on all sterile things are not sterile. Don't turn your back to the sterile field, and then acknowledge breaks and be honest. Skin is not sterile. You must use sterile gloves to touch anything in a sterile field. Sterile water is only sterile in the bowl only, and it's only sterile in the bowl. Fluid flows in the direction of gravity, so that's a consideration. Nothing below your waist is sterile, and exposure, limit the amount of time that the sterile field is open. So I'm going to utilize that 1-inch border here, lift this up, carrying this one as well. Okay, and I'm going to start adding things without reaching across. I'll add my bowl here. I'm going to open it, so I'm keeping an eye on it, but not letting anything go over it, not letting anything outside of this package touch anything on here. 1-inch border. I'm just gonna drop and then continue to add things, not directly over. Keeping an eye on my sterile field here, pulling everything over. And I use that as like a barrier, and I'll open my bandages here. Okay, I'm gonna take a sterile fairy on this just because it's stuck to the tape I tried to re-bandage it or re-put it together with. That was my 2 split sponges. I'm gonna do my ABD pad. And then I'm taking my sterile fluid, ensuring again it's not open, and I'm not gonna reach over. I'm gonna cover the label with my hand. After I take this lid off and pour it in, it's 4 to 6 inches above the bowl, I'm gonna put the lid back on and just set it out of the way. In real life, I just drop it, but I'm not gonna waste this fluid. 4 to 6, not reaching above. Okay, and then I drop it, but I'm gonna cap it, keeping my eye on the sterile field, putting it behind me. Then I'm gonna keep my eye on the sterile field, sanitize, and then glove up. Okay. Utilizing my 1-inch border here. Using my non-dominant hand, I'm gonna be able to touching the inside of my cuffling here, and I can keep that. Keeping an eye on the sterile field. Okay, so now hands together above. Now that my hands are sterile, or my gloves, I'm wearing sterile gloves, I can arrange my sterile field the way I would like it. I'm gonna put 3 moistened, there's 2 in there. 3 moistened gauze. Oh, they're both right there. Never mind, I digress. Nothing's touching my 1-inch border. And then just kidding, I only have 2 sterile, or apparently I repackaged wrong, so I only have 2. So we'll do 2 good, 2 cleaning, and then I have this, and then my ABD, and my 2 split sponges that I'll be placing on. Okay, I'm just sacrificing this hand to the wound here, holding the drain up. I'm gonna getting it off so I don't grip. One swipe without getting it back over my sterile field. Swipe the opposite way, drop, drop. I'm assessing the wound now again for size, shape, depth, location, and ensuring that there's no signs of infection, change of alertness, the patient is not feverish, there's no deep red granulated tissue, there's no swelling or warmth, and the wound is not odorous, and the patient is not feeling pain to the touch around the site, as well as change of level of consciousness alterations. So I'm going to place my ABD. And I'm gonna drop the drainage, and my hand is still sacrificed. I'm going to put this on, throw my ABD on here, and at this time my wound is covered, so I do not need to worry about my sterile hands. I'm gonna take the tape I have here and place it on all four corners, or picture along the edges. I'm going to date, time, and initial. Date, time, and initial. So it is 1200. Awesome. I'm gonna cover my patient back up. While I'm here, is there anything you need? No, I have plenty of time. I'm disposing of my gloves properly. I'm gonna sanitize. He doesn't need anything else, so I'm going to, I have plenty of time. I'm gonna put his bed low and locked, ensure his call light is within reach, his bedside table is within reach, his railings are up appropriately, his room is free from fall risks, oh my goodness. Document all my findings in OneNote. Report per agency policy, clean up my supplies, leave the room, and perform hand hygiene.